Hi, I'm Dr. Taparia. I'm a consultant rheumatologist at KIMS Hospital in Thane, and today we're going to be discussing about juvenile arthritis. So, juvenile arthritis is a group of conditions where the child can get joint pain, swelling or stiffness, and it usually occurs below the age of 16. So now all of us believe that arthritis happens to old people, but that's not true. That kind of arthritis is something which happens with wear and tear of the cartilage with aging. But there's another type of arthritis called as inflammatory arthritis, which can occur at any age group, including children. And this is basically an autoimmune condition. So I'll explain what autoimmunity means. Here your immune system, where it's supposed to be fighting infections, starts attacking its own organs, and in this scenario your joints, and that's why it manifests with joint pains. So this is an extremely important question because like most adults can express their pain, children may not be able to. So these are certain signs that an adult can look out for in their children or someone they come across. So the first one is morning stiffness. So what do I mean by morning stiffness? So when your child wakes up, he may have difficulty in moving out of the bed or takes longer than usual. The child may complain of tiredness in the legs or heavy sensation in the legs. This is definitely a red flag sign. A second sign to look for is swelling. So if you see puffiness in the finger joints, wrists, knees or ankles, this could be a sign of inflammation. The third thing is that the child may be limping or avoiding certain activities. So normally if a child is not injured, he shouldn't be limping. So if you see an unusual gait or walking style, or the child is not doing his usual activities as a result of pain, that could indicate some joint issue. Another important sign to look out for is unexplained tiredness or fatigue. The child having low energy and you cannot make sense of why it's happening. This could again point towards underlying inflammation. And the last and most important is there are certain associated signs. So arthritis does not just come in joints, it can manifest in other ways as well. So if your child is suffering from fever, which is recurring and you don't have answers, you've been to doctors, the doctors are saying there's no infection, but the fever comes back again. Or if there's rashes like faint pink rash seen over the trunk, that is your abdomen and chest at the time of fever, this could again be a sign of inflammation. So you have to look out for these signs and make sure that you get to a doctor if you notice any of them. So this is a very common question that is usually asked, and it's often a parent's wonder that why did my child get arthritis? So to tell you the truth, we don't know the exact cause, but we do know and have some understanding as to why it's happening. So like I had mentioned, it is an autoimmune condition, so there is something wrong with the immune system. Now there are two factors that play here. One is genetics and second is some environmental trigger. So your child's genetic makeup can predispose him or her to develop arthritis. But this is a predisposition, meaning that it's not compulsory that if the child has this certain genetic makeup, he or she will definitely get arthritis. So the second factor that comes in here is the role of an environmental trigger, which could be in the form of a viral or a bacterial infection, which can trigger the immune system to react in an unusual manner. So this is not something that you have given your child or something that you can prevent with, say, diet or lifestyle changes. It's neither contagious that if one child has it, the other one will get it. So if you see children, sometimes they don't even have family history of arthritis in their family, but they do suffer from these diseases. So even though we cannot predict the fact that who may get this disease, we can definitely recognize it early, treat it, and make sure that the child leads a normal life. So this is a four-pronged approach. The first, when you go to a rheumatologist, they will ask you the symptoms of the child, meaning which joint is hurting, where is the pain, where is the swelling, where is the stiffness. There will be additional questions to inquire if the child is having fever or rashes, chest pain, abdomen pain. So there's a big questionnaire that is to be answered. Following that, the doctor will examine the child to see which joints are tender, which joints are swollen, what is the extent of involvement. There may be some supplementary blood tests to be done to look at the markers of inflammation, as well as certain tests to look for autoimmunity. And sometimes there may be certain scans or x-rays that may be necessary to see how the joint is behaving. After doing all this, if arthritis is diagnosed, the treatment plan is simple. We need to make sure that the child is pain-free and is able to restore his daily activities. So here comes in the role of medications, which will be aimed at reducing the pain, the inflammation, as well as keeping the immune system in check. The second is physical therapy. As important as the medications are, exercise plays an extremely important role in arthritis because we want the joints to be flexible and have strength. The third thing which will happen to some children is an eye checkup. Now you'd wonder, why am I saying eye checkup? Because it's not affecting the eyes. But actually sometimes even without having symptoms in the eye, there can be affection of the eye in autoimmune conditions. So sometimes we may refer you to an ophthalmologist. And lastly, and the most important, is to be on regular follow-up, that is periodic checkups with your treating doctor, because this disease is not something that will disappear over a time of some days or weeks. It can go on for months and years, and that's why it's really important to have regular follow-ups and keep a check whether the disease is in control or not. So it's a really personalized plan for each child, with the doctor, with the therapist, with the parents, as well as the child, based on the child's needs. This is really important because arthritis is not something you deal with just medications or just a monthly doctor visit, because you have to deal with the child on a daily basis. So here parents as well as school teacher and school support staff become very important. So here are a few pointers that you can do at home if you have a child with arthritis. First of all, listen to your child, because the child might look externally normal but may be in pain. Second, form a daily routine which involves adequate rest as well as gentle exercises. The child may need more time to wake up in the morning and get to school than other children, so that needs to be accommodated into the daily routine. Third, celebrate small victories, because sometimes the child is in pain but is able to complete his or her homework on time or participate in physical activities. So this is really important to boost their confidence as well. Now coming to school, it's really important to communicate to the teachers as well as school staff that your child is suffering from arthritis, because they may not be aware of this condition. The child may need additional help in completing tasks, carrying heavy school bags or climbing stairs. Sometimes when the child is in extreme pain, they may not want to play sports or go for physical education classes. So communication becomes a really important part in planning this treatment and making sure the child grows well and is pain-free as well. So that's definitely a myth, as we have discussed earlier, that old people do get arthritis of the degenerative, that is the aging kind, but inflammatory arthritis can happen at any age group, and that is why there's a special term for children, juvenile arthritis, because yes, they do suffer from it and it needs to be picked up early. So there is a terminology called growing pains, but that is very different from juvenile arthritis. So what happens in growing pains is, as the child is growing and his bones are growing, they get these mild aches and sores, especially in the legs at night, which may be on and off. It's not a daily thing that they suffer from. But juvenile arthritis is different. It is inflammatory, so you get all signs of inflammation. That is, apart from the pain, there will be stiffness, there will be swelling, and the child will have difficulty in walking and carrying out daily activities. So these are two different conditions, and arthritis will go on for way longer. So if somebody is suffering even from pain and you don't visibly see a lot of swelling, but the pain is going on for weeks or months, it could be arthritis, and it's better to get it checked by your doctor rather than just sitting on it thinking that the child will outgrow it. So this is definitely a myth. Now, contrary to popular belief that you have joint pain so you should rest because that will help in recovery, this is not true. But the right exercise is important. And why is exercise so important? It helps in flexibility of the joints, it will help in strengthening the muscles around the joint, and it actually helps in elevating the mood and overall energy levels. So by exercise, I don't mean send your child for high intense sports. It basically means to get some gentle exercise involved in the form of stretching, swimming or cycling, which will not put too much stress over the joints. With this, it will ensure that the joint is not going into stiffness, and over time, in fact, if you do not exercise, it is counterproductive. There will be weakness of the muscles, the joints can get stiff, and the child will develop deformities. So that is why physical therapy plays an extremely important role in the treatment plan of juvenile arthritis. So juvenile arthritis is a real medical condition, so please don't underestimate the pain of your child. If you see your child suffering from joint pain, stiffness or swelling, do seek a doctor's opinion, even if it doesn't turn out to be something, because these diseases caught early, and if you institute treatment early and on time, we can ensure that this disease does not affect the growth of the child and the child can lead an absolutely normal life. So thank you for being part in the effort of raising awareness about this really important condition, because the more we understand it, the better we will be able to support these children who live with arthritis on a daily basis. Thank you.